Let's start with the internal carotid artery. So internal carotid artery is going to start at the bifurcation of the common carotid artery. So its origin is going to be common carotid artery. Now I have a very important mnemonic for you that you have to remember to know its course. Okay. So CCADSL. It makes no sense, but please remember this. So basically, it is going to ascend the neck and it is going to perforate the base of the skull by passing through the carotid canal. So C for the carotid canal. And from the carotid canal of the temporal bone, it is going to run horizontally and then it is going to go forward into the cavernous sinus. So C for the cavernous sinus. And then it is going to emerge on the medial side of the A for anterior clinoid process. And it is going to perforate the what starts with the D, the dura mater. And then it is going to enter the subarachnoid space S. And then it is going to enter the lateral cerebral sulcus by turning posteriorly. Now it is going to divide into anterior and middle cerebral arteries. Now let's discuss the cerebral portion branches. So we have 5 branches here and we also have further branches there. But first, let's discuss these. So we have ophthalmic artery, choroidal artery, the anterior and middle cerebral artery, and posterior cerebellar artery. So now let's talk about the ophthalmic artery and where it supplies. The ophthalmic artery is going to supply what? The eyes, of course. It is going to supply the eye as well as the dorsum of the nose, as well as some sinuses, okay? So what sinuses come to your mind? Frontal sinus and ethmoidal sinus. This is also going to supply the scalp. Here you can see the ophthalmic artery. Let's talk about the posterior communicating artery. Posterior communicating artery is just going to join with the posterior cerebral artery, and then it is going to form the circle of Willis. Now let's talk about the other artery, which is the choroidal artery. So the choroidal artery, what comes to your mind when you think of choroid? Somehow it is related to the eye. So it is going to supply the optic tract lateral geniculate body. Where did the lateral geniculate body come from? From the superior colliculus. And it is also going to supply the crus cerebri and the internal capsule. Let's talk about the anterior cerebral artery. Anterior cerebral artery is basically going to supply the medial side of the middle cerebral artery is going to supply the lateral side of the skull. Okay. So anterior cerebral artery is going to divide into further 2 branches, but it is going to communicate with another branch. Okay. So please remember that it is going to communicate with the other anterior cerebral artery by the anterior communicating artery. So it is basically superior to the optic nerve. And it is going to divide into further 2 branches, which are the cortical branches as well as the central branches. So please remember that cortical branches are going to supply the cortex. So they are going to supply the medial side of the skull, as I discussed before. They're going to supply the medial side of the cerebral cortex as far as the parieto-occipital sulcus and a strip of the cortex, which is about 1 inch in width on the adjoining lateral surface. This is a very important MCQ that it is also going to supply the leg area, which is in the precentral gyrus. And cerebral branches of the anterior cerebral artery are going to supply where? They are basically going to supply some nuclei and a capsule. So what are the 2 nuclei? They are the lentiform nucleus and the caudate nucleus. And what is the capsule? Internal capsule, which is the middle cerebral artery, which is the biggest branch here. So it is going to supply the lateral side of the skull. It is also going to divide into cortical branches and central branches. Central branches are going to supply, they're going to enter the anterior perforated substance and they're going to supply the same nuclei and the same capsule, which are the lentiform and caudate nuclei and the internal capsule. What about the cortical branches? So the cortical branches are going to supply the cortex and the lateral surface of the cortex, except for the area which was supplied by the anterior cerebral artery, specifically the lateral 1 inch which was supplied by the anterior cerebral artery, as well as the fronto-occipital sulcus and the inferior pole, as well as the intralateral surface.